Governor Felix Camacho and U.S. Virgin Islands Governor John DeJong are urging leaders on the Senate Finance Committee in a letter to include U.S. territories in a key provision of healthcare reform legislation the committee is drafting. Under the current draft of the bill, Medicaid spending on newly eligible healthcare recipients in the U.S. territories would be exempt from a federal cap. But the bill is silent on whether the territories would be included in a plan to boost the amount of federal healthcare funding states get in the form of matching funds to pay for expanded health services. The bill does give a slight boost to the amount of matching funds territories would get for currently eligible patients, but the governors say people living in places like Guam and the Virgin Islands would still be at a severe disadvantage when it comes to health care compared to their counterparts on the U.S. mainland.
In general, with Senator Baucus's bill, it falls short in addressing the full needs of not just Guam, but all the territories. We're very clear in terms of the treatment of the territories in relation to health care that there should be some equity.
In the letter, the governors tell Finance Committee Chairman Max Baucus and Ranking Member Senator Charles Grassley disparities in health care could be reduced if the bill was clarified to ensure that changes to the matching grant formula applied to the territories.
Well, it affects Guam for the fact that in terms of what kind of percentages that we would receive in federal funds, in terms of what kind of matching requirements that we would have to put up. Currently, we have to put our local monies up against federal money to gain the full amount of the federal monies. We have to put up a certain amount of money. In terms of the caps, by lifting caps, it allows further federal funds to be pumped in where the local dollars don't have to be used.
Meanwhile, the committee's bill could hold other healthcare problems for the territories. For example, the Washington, D.C. newspaper The Hill reports that under it, territorial healthcare recipients would face higher barriers when enrolling in Medicare Part B, which covers non-hospital medical services, and that they would also see lower Medicaid reimbursements. Stefan, Sebastian, PNC News.